Hi. I wanted to record my healthcare story. About 4 years ago, my wife came down with double pneumonia. She was admitted to the hospital. She ended up being in the ICU for over a month. Um, she was on a ventilator. It was very touch and go whether or not she would make it, and thankfully she did. She did make it. Um, she was released from the hospital. She has permanent lung damage because of the pneumonia and the infection. For about 6 months out of the year, it's really difficult for her to be outside during the warm months because where we live, the air quality is really bad, and because of her lung damage, that she has to be in air conditioning essentially. It definitely helps. So it really has restricted our lives. Um, and to add insult on injury, about a year after she had pneumonia, our health insurance company saw fit to essentially double our premiums. We were paying about $8,000 a year for health insurance, and they're raising them up to over $16,000 a year. And we're essentially outcast. We've applied to many different companies trying to find somebody who will pick us up for something reasonable, and nobody will even touch us. Um, because of her healthcare history, uh, we are essentially lost. We don't have any options. Um, which brings me to this next election. There are so many people that are in our situation that are just you work every day. You try to do what you can to make it, and um, a health situation creeps up and essentially ruins your life. Um, and you really don't have any options. I mean, we are in the place where either something has to happen soon, or we don't know what we'll do. I mean, do we move to another country? Do we? Um, I don't know. I don't know what to do. And I think that's what scares me about this election is that it's become very clear that healthcare is a huge issue, and I really do think that something is going to happen um, during this next election. I'm afraid that in the rush to do something, because we really want something to happen with healthcare, that we're going to accept anything. And I look at all of the plans that are out there, and I just don't see anything that really essentially does something meaningful. I There is a bill in Congress right now that would essentially give universal health care. It has about 15% support in Congress. So I think we essentially have to forget the idea of universal health care, government sponsored universal health care, because there's just no political will to do that. And all the presidential candidates have plans, but they all are this really watered down compromise on universal health care. And I was really excited to hear that Hillary Clinton was running for president, it's like finally something is going to happen. And when she came out with her proposal, it's like my jaw dropped to the floor. It's like, what do you? This is what you came up with? You know, what she is proposing is essentially what the Republicans did with the Medicaid prescription drug plan. You know, that we will not negotiate prices with these companies. We will give you all of this business. Last year, um, the pharmaceutical companies got 18% more business because of the prescription drug plan. And Congress did not ask them to lower the prices at all. You know, Hillary Clinton's proposal for a radical change in healthcare would give insurance companies 47 million new customers and not ask them to reduce their prices at all. And I just am afraid that it's just more of the same. I feel that we're being left out of the process. And we are the people who are paying all of these bills. It is our money. How are we being left out? And we shouldn't be left out. And the only reason that we are is because we're not standing up. We are not making our voices heard. And we're not saying that, you know, this current system is not acceptable. It's not acceptable. And any new system that is going to come about has to have our approval. It can't be negotiated behind closed doors. That it has to be a solution that we all agree with. And the only way that's going to happen is if we all stand up and make our voices heard. If we end up with something that benefits everybody but us, benefits the insurance companies, benefits pharmaceutical companies, we don't have anybody to blame but ourselves, because we've sat by and watched it happen. It's not good enough to pull a lever for our favorite candidate. If healthcare is something that is affecting you, then you have a responsibility. You have a responsibility to make your voice heard. And you need to stand up. And we need to take back our healthcare.